Committee will come to order. I apologize to everybody in attendance. We're getting organized up here this morning. Clerk, please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Wilson, Representative Bridges, here. Representative Gordon, here. Representative Marzian, Co-Chair Lewis,
Here.
Chair West.
Here. We have a quorum. We are duly constituted to conduct business. The first matter of business is approval of the minutes of the last meeting. Are there any additions or corrections to the minutes? Seeing none, is there a motion for approval of the minutes? We have a motion and a second without objection, so ordered. We are going to immediately go into our regulations, and as is usual in this committee, we are going to go completely out of order. So first up on the agenda, bear with me. Some people are going to like this, some people are not. The order of things. But first up on the agenda, we have the Department of Medicaid Services. If they would come to the table, 907 KR 3320.
Yes, Cabinet for Health and Family Services, Department for Medicaid Services, 907 KAR 3320 and 907 KAR 23010. Both regulations have staff suggested amendments.
907-3320 establishes the Beneficiary Advisory Council and establishes additional requirements for the Advisory Council for Medical Assistance, known federally as the Medicaid Advisory Committee. The staff suggested amendment amends various sections to comply with KRS Chapter 13A.
907 KR 23010 amends to allow reimbursement for prescription weight loss and anorexia drugs. The staff amendment amends various sections to comply with KRS Chapter 13A.
Would you please identify yourself for the record?
Good morning. I'm Lisa Lee. I'm the Commissioner for the Department for Medicaid Services.
Hello, Jonathan Scott, Chief Legislative and Regulatory Officer at DMS.
Thank you. There are staff amendments. Is there a motion for approval of the staff amendments? We have a motion and a second. Without objection, is so ordered. Before I open the floor up to questions, there's going to be quite a bit of discussion today on 907 KR 023010. Before we get into the discussion on that, could you just kind of briefly give us a synopsis of what you're doing?
And this is the weight loss, right? So what we're doing with this regulation is we have amended it to remove language stating that we will not cover GLP-1s for only obesity-related events. So what we're doing is we have this regulation is going to have some coverage of the medications. Let me start all over here. Get me going this morning.
Take your time.
Coverage of these medications are going to be, they're going to have guardrails around it. We will have prior authorizations. It will not just be for cosmetic purposes. It will be for individuals who have an underlying chronic condition such as diabetes or cardiovascular events before they can be approved. It's not going to be a very first line of defense for obesity only. Again, it's designed to assist individuals in improving their health status, reduce future costs related to obesity and heart disease and in the Medicaid program as we go forward. So that's basically what we're trying to do is have a pathway for those individuals who would qualify for these medications based on their medical need.
Thank you for that. Before I have some questions, but I'm going to hold my questions for now. Do any other members have questions? Representative Marzian.
Thank you, Mr. Chair. So I hear you're going to have some criteria as far as diabetes and cardiovascular. Thank you. Is there going to be a criteria for a weight amount or a weight limit or set there?
Individuals will have to again, have that underlying medical condition. If they again, not a first-line defense. If individuals have diabetes, for example, and they have tried to control their A1C through other lines of therapy and it has not worked, but the full criteria will be is established by our P&T committee. Our Pharmacy and Therapeutics Committee will have input into the coverage of these medications. And as we go forward, I mean, we're thinking, first of all, it's going to be diabetes, because these drugs are FDA approved for diabetes. There'll be diabetes, heart disease, and as we go forward, if there are other conditions that may need to be added, then that would be in conjunction with their Pharmacy and Therapeutics Committee.
Co-Chair Lewis.
Thank you, Chairman. Commissioner, thank you for coming today. I do appreciate what you're doing here. Just had a few questions in my conversation with Secretary Stack. We got on the topic of the cost, and I was just kind of curious. I know you're going to have future savings more than likely, but how was all that calculated?
We have in our fiscal impact in the regulation, it is all spelled out. But basically, we look at our current expenditures. We look at the current health status of individuals enrolled in the Medicaid program. We know, for example, that we have a little over 20,000 individuals in the Medicaid program on these medications currently. That's out of 1.4 million individuals in the program. So we look at those health status of those individuals and just project. And of course, this is all it's all subject to personal preference, providers if they're even going to write prescriptions for these drugs. But we have a fiscal impact of.
So our office.
There you go.
Sorry about that. Our Office of Data Analytics did do a review of this. So you can come up with a big scary number, but then they also looked at the anticipated actual utilization, some of the cost savings that would be expected and set aside, and then you also have to look at kind of the anticipated annual use, how long that use will actually persist, the step therapies that will go into place. So the anticipated utilization when we looked at states like Mississippi that have introduced this was I think the reimbursement cost was in here. I think we had an actual reimbursement cost of $1.1 million in state funds before you get to any cost savings that we would expect from introducing them and preventing diabetes, preventing treating prediabetes, and then a lot of times the step therapies are going to involve, like, is this obesity is looked at in levels now, so or someone who is just overweight without some other type of condition would not qualify. So you would have to have a higher level of obesity plus prediabetes, a heart condition, things like that. And at that point, the savings really begin to be introduced in our program. And then another thing to consider about diabetes is the additional doctor's visits that you'll have, diabetes supplies, and things like that. So your cost actually changes quite a bit when you start to introduce the other drugs in the formulary.
And I would like to add that we would only be covering these drugs if they're subject to rebates. And noting that the Medicaid program is 70% funded by federal government, and I understand tax dollars are tax dollars regardless of the source, but the federal government is willing to invest dollars in these medications and help states improve their health care status as we move forward.
Thank you, Commissioner. Thank you, Jonathan. Another question, Chair?
Please proceed.
And Jonathan, you touched on this a little bit, but I know there have been some other states that have looked into opting this program, and so I assume you are in those guidelines as you go. How long have those policies been in place? And I guess I ask that just so we do kind of have a playbook on what the policy looks like, what maybe additional challenges or additional costs that maybe we haven't foreseen.
Yeah, well, each state is definitely different on the populations they cover and their criteria for covering the medications. We have looked at other states and what they're doing, but our criteria is definitely going to be Kentucky specific, what the needs of our population are. We know we have a very high prevalence of diabetes, heart disease, obesity in this state. We also know that we recently, in America's Health Rankings, we moved from 41st to 43rd. So we do believe that the rate of obesity in this state is really something that needs to be addressed, and these medications will help us, but only again with those individuals who have an underlying health condition. This is not going to be covered simply for cosmetic purposes. It does have a medical need in it, and we will have those prior authorizations and some controls in place to make sure that only those who meet that criteria will receive the medications.
Thank you, Commissioner. One more comment, if I can.
Please proceed.
Thank you, Chair. So I'm torn on this one. So, I've got pharmacies in the East, and I've seen firsthand patients that have truly benefited from this type of therapy, and you do see, their health outcomes improve, and their lives are changed, frankly. But on the flip side of that, on the business side, I went back and I looked up some of my costs in January for the stores, and GLP-1s made up about a fifth of that. And I know we're not factoring in rebates or anything like that, but I know with the discussions of potential Medicaid cuts, I'm just, the timing of it gives me a little bit of heartburn. But I do appreciate what you're trying to do. I don't know that I'll be with you this time on policy, but I do understand and appreciate what you all are doing.
Thank you for that. Completely understand.
Senator Rocky Adams.
Thanks, Mr. Chairman, and thank you all for being here. How do we have people in the Medicaid program currently on this if statute and reg do not allow for them to be on this?
The regulations specifically stipulates an exclusion for obesity. However, the drugs have been approved for diabetes. So those individuals who are on the GLP-1s right now have a primary diagnosis of diabetes that is for which these medications have been approved. Just removing the weight loss would allow individuals, that weight loss criteria in there would allow individuals who are overweight and who have other underlying health conditions other than diabetes, such as heart disease. Again, everyone would be examined on a case-by-case basis. Criteria would be followed to make sure that only those individuals with an obesity diagnosis in addition to diabetes, heart disease, or another chronic disease would be eligible.
Can I have a follow-up?
Please proceed.
So of those in the Medicaid program that are currently receiving a GLP-1, what are the outcomes for those? Have we seen any change? Have we seen an increase in expenditures? Are they healthier? Are they going to roll off of the GLP-1? What does that population look like?
That's a very good question. I don't have all of that information with me, but I'd be more than happy to get that. And I think, too, that as we move forward, can understand the concern for the cost. And I think the Medicaid Oversight and Advisory Board would be a really good source to look at some of the data and the information and outcomes, design those reports that we would want to see to determine the future and if we need to tweak this program in any way or shape or form.
And I'll my final comments is that as the co-chair of the Medicaid Oversight and Advisory Board, we have had this preliminary conversation where we asked you all to come and kind of talk about this change. And just for the viewing public to know that I think that we have scheduled we're in the process of scheduling our February Medicaid Oversight and Advisory Board meeting, and this will be a topic. And I think that it will be good because we can get that holistic understanding from kind of all the stakeholders about what does that mean from a budgetary standpoint, from a health standpoint, that, I struggle like my colleague that this venue is fine to talk about the regulatory piece of it, but I think Moab is a really appropriate place to talk about the holistic policy that goes around this, because this is could be potentially a very big expenditure for the taxpayers, and we got to look at those health outcomes. Thank you, Mr. Chairman.
Any Representative Bridges has a question.
I'm sorry, but I've got to ask, what's that scary number you failed to instruct us on?
you can just take your general idea of how much it is per month. You wouldn't have our rebate information, but if you just start saying there's 1.4 million people in Medicaid, and I'm going to multiply this by whatever the cost is, it looks exorbitant. And then when you look at the real world utilization, especially within just a weight loss population at a certain level before you put in step therapy, it's different. But I the number would change every month based on what your
May I respond to
drug
that,
cost is.
Mr. Chair?
Are you done, Representative Bridges?
May I respond to that?
Please proceed.
Okay.
Yes.
And no offense, but this is government, and it tends to exceed what the expectations are. I've got some concerns on that. But if you said you had a fiscal note on that.
It's in the reg. It's in the documents that you have.
Okay.
We have that, Representative Bridges, if you
Okay,
need a copy
okay,
of that.
I
We have a
didn't see it, but I-
detailed impact statement.
I'd like to see that too. And I do appreciate what you're doing. This is just one that's hard to, it raises major flags and concerns with what's going on at the federal level too. So thank you.
You're welcome. Any other members with questions? Seeing none, I got a couple questions. Most of those were asked already. Most of mine were asked already. We passed Senate Bill 25, I believe, last year, that requires anything of significant impact, basically to go through the legislature, right? I apologize. House Bill 695. I'm getting my bill numbers mixed up. So did you all run that through that rubric and kind of, is...
Well, this is just, we have a formulary in Medicaid that lists all of our medications, and this is, again, these medications are already on our formulary, so we didn't see that as a change in benefits or a change in eligibility. I mean, again, we add and subtract medications from our formulary on a routine basis.
Gotcha. And so my second question will kind of tie back in with what Senator Adams was touching on, and she brought up a very good point that, this is a major sea change in what we're doing, and most of those issues will go in front of MOAB, Medicaid Oversight and Advisory Board. And don't you think we're getting the cart before the horse here a little bit? Because you talk about, we'll go ahead with it. We'll come in front of Medicaid Oversight and Advisory Board, and then, if something's not right, we'll just pull it back or claw that back. And we've seen this hundreds of times since I've been in the legislature. That's easier said than done. And so you roll this thing out, people get used to receiving the medication, and all of a sudden, everybody up here that's a legislator, we're the bad guy because we're pulling back something that they're entitled to according to law. And I think this thing is like wildfire. I mean, it gets out there immediately and becomes, to be honest, I think 1.1 million is a tremendously low number. I think that immediately goes up exponentially. And just comment on that. Shouldn't we be going in front of MOAB first and letting it go through the process rather than just rolling it out?
Well, there have been, I completely understand your concern about the growth of these medications once we start approving prescriptions for individuals with a chronic disease. But again, we are putting those guardrails on front. We have seen other states that have covered these medications. They seem to be doing fairly well. There have been some reports
Did they cover them in the same way? Did they cover the weight loss component? Or are they covering them kind of like we're currently covering them?
Some of them covered just for the weight loss component only.
Okay.
But we, again, are going to put those guardrails up front to make sure that only those individuals who truly need these medications to improve their health status receive those medications. We know that there have been studies, for example, that show these medications can assist with addiction. We know we have a huge issue in this state with addiction. There have been other studies that show the positive outcomes related to individuals improving their quality of life. Again, cost reduced associated with long-term care for individuals with diabetes and heart disease. And there are others out there, but there are certain studies that definitely show the positive impacts. And we know that Kentucky does have a high rate of obesity. That's one of the things that's keeping us at America's Health Rankings at that lower rate. And we do believe that these medications, if implemented appropriately up front, will help those individuals that we serve, will help them improve their quality of life. And I just think, again, I understand everything that you're saying about the concerns. I've worked in Medicaid for over 25 years. So I know, but I think at this point we have to do something to help those individuals who are trying to improve their health status and they just don't have the appropriate tools. This is just another tool to help them improve their health status.
Gotcha. And that all sounds logical. And so I definitely appreciate that. And does anyone else have Representative Margin?
Thank you, Mr. Chair. And when we talk about helping people that have diabetes and maybe reducing it or making it better, I'm a former kidney disease nurse, and a third of our patients on dialysis were diabetic. And probably half of those are on Medicaid. And dialysis is like $200. That's been a while, so it's probably $300 now per treatment. So that's 3 times a week that we're paying out. So if we can prevent that, I don't know if you all factored that into your savings. And then a lot of those diabetics need repeated shunts put in, they need transplants, they have amputations, they have heart attacks, so that cost is just phenomenal. So I think, I worked in that real life and saw those diabetics every day. So I think if we can prevent that, it would save us money and get good quality of life too. So I can talk about transplant and diabetes all you want, but I'll shut up there. Thank you.
To be clear to Representative Marzian's question, if a person's a diabetic and has a serious medical condition, we currently cover that under the existing law, correct?
Correct.
Okay, so we're already doing that component of it. This is just an expansion beyond that. Correct? Is that correct?
Yes, that's correct. We're just removing that language that says we will not cover for obesity.
Gotcha. Got the weight loss aspect.
Right.
All right. Any other members have questions? Seeing none, I'm going to make a motion right now on this, and just in preparation, well, I'll save it for discussion. My motion is that we find this regulation 907 KR 023010 deficient.
Second.
We have a second. Is there any discussion? I'll start the discussion. We're not saying that you're not doing the right thing or attempting to do the right thing in this motion for deficiency. What I'm trying to say is the legislature needs a say, and actually the timing is perfect because we're right in the middle of a budget session, and so we can have a full discussion during this session. Hopefully we can have this in front of Moab for discussion and review, and really get our head wrapped around what this is going to cost. And so go into this eyes wide open. We know what it's going to cost, and everybody's on the same page, and you get some legislative buy-in. And I think that's going to be, rather than letting the horse out of the barn and trying to get the horse back in the barn. So that's the reason I have made the motion for deficiency. We have a second. We're in discussion phases. Any further discussion from Co-Chair Lewis?
Again, I'll echo what my co-chair said, but I do appreciate what you're doing. Between the federal changes, what we're looking at doing, and bills like House Bill 2, Moab, I have concerns on both the budget side of it and then just the timeliness of it. But in terms of policy, I don't know that I necessarily would be opposed to this. It's just I don't like the timing where we are right now. Thank you.
Any further discussion? Representative Marzian. Make sure your microphone is on, please. It's okay.
Do we need to adopt the staff's suggested amendments? Or did we?
They've been adopted.
Oh, okay, never
Yeah,
mind.
The amendments have been adopted, yes. No problem. The question before us is on the motion for deficiency. All those in favor of finding the regulation deficient will vote aye. Those opposed will vote no. Please call the roll.
Senator Rocky Adams.
Can I explain my I vote?
Please proceed.
I'm going to vote aye, partly because the way that it is right now, we still have folks that are able to access this drug if they have diabetes and some other health maladies. So, and I also wanted to say that Moab will have this on their agenda the last Monday in February. So just take note.
Senator Chambers Armstrong. Senator Wilson. Representative Bridges.
Explain my vote.
Please proceed.
I think there's a lot of good here, but I think we're already addressing the most acute situations that's in current regulations and statutes, and I have some concerns on some of the expansions and the cost, and we've got to keep our base down there to where we can afford it before we can expand. So with that and what's going on, I agree with the chairs, the co-chairs, that we need to look at that first, get some harder numbers, and also get it before the proper group, which I believe is Moab, and see what they have to say about it. So at this time, I will agree to find the deficient favorable. Thank you.
Representative Gordon. Representative Marzian. Co-Chair Lewis.
Aye.
Chair West.
Aye.
We have 5 ayes.
The roll
So-
call. 5.
Yeah.
The roll call shows 5 members voting aye and one member voting no. The motion to find this regulation deficient has passed.
Thank you.
Thank you so much. Appreciate it. Next up on the agenda, we have the Public Protection Cabinet. Department of Alcoholic Beverage Control,
Yes.
if you would come to the table.
Public Protection Cabinet, Department of Alcoholic Beverage Control, 804 KAR 13010 emergency, 020 emergency, 030 emergency, and 040 emergency. 804 KAR 13030 emergency has staff suggested amendment.
804 KR 13010E amends to add language pursuant to Senate Bill 100 from the 2025 regular session. The amended after comments version amends Section 6.2 to clarify that the evidence referenced as property seized as contraband property during investigations. 804 KR 13020E establishes the form for the tobacco, nicotine, and vapor product license application. The amended after comments version amends Section 5 to state that the department shall grant an extension of 30 days if a license is not renewed by expiration. Amends the initial license application to remove attestations regarding sale of hemp products and presence of gambling devices, and amends instructions to the initial license application to remove the line stating that background checks may be required at any time. 804 KR 13030E establishes reasons for which the commissioner shall or may deny an application. The amended after comments version deletes a portion of Section 1.2, which stated that an application shall be denied if the applicant is engaged in any activity for which revocation of a tobacco, nicotine, or vapor product license would be authorized. The staff amendment amends Section 1.2 to limit automatic denials based on false material statements to those made knowingly by the applicant because it was added by the department in the statement of consideration but inadvertently omitted from the filed version of the regulation. 804 KR 13040E establishes the process for applying for a transitional tobacco, nicotine, or vapor product license.
Would you please state your name for the record?
Yes, my name's Joshua Newton. I'm the general counsel for ABC, and if I could give a brief statement.
If you could hold on one second.
Absolutely.
There is a staff amendment. Is there a motion for approval of staff amendment? We have a motion and a second. Without objection is so ordered. So we had to do that real quick. The floor is yours.
Thank you, and good afternoon. And
Could
thank
you do me a favor? Pull that microphone a little bit closer there.
Thank you.
Thank you.
And good afternoon, and thank you for the opportunity to speak to you about the department's implementation of SB 100. As you know, I was here for an informational hearing on December 8th of last year regarding these regulations, these emergency regulations, and at the time, there was fear that the department would not be able to license tobacco retailers quickly enough to ensure there wouldn't be any interruption in the tobacco sales come January 1st, 2026, when SB 100 went into effect. Today, I'm happy to report that as of 11 a.m., we have received approximately 5,500 applications total and have issued nearly 5,000 TNVP licenses. We call them TNVP just because it's a long name. And of the remaining, about 100 or approximately 100 are just awaiting final payment. So that just leaves 300 or so that are still in the process. Much of this was made possible through the hard work and dedication of our licensing staff, who worked tirelessly to get applications approved before the January 1st, 2026 statutory deadline. However, just in case that wasn't enough, we took initiative and promulgated another emergency regulation that established a temporary provisional license to anyone who had applied for a TNVP license before January 1st, 2026. We issued 1,200 approximately of those, and of those applicants, about 700, a little more than 700, have been issued annual licenses. That overlaps with the numbers we already gave, and approximately 250 of those are still pending review. And for those, I wanted to say, as part of our application process and the application, we required people to submit photographs of their premises. The reason these are pending is because when some of these people submitted those photographs, we discovered that they were selling nicotine vapor products that appeared to be unauthorized. And so we asked in those instances if they could either provide documentation to show that they were authorized in accordance with statute, or remove those before we were able to approve their application. And so those are what most of those applications pending are awaiting. We believe doing this furthers the intent of the legislature in passing SB 100 to stop the sale of unauthorized nicotine vapor products. And so as you can see, after the hard work and measures the department undertook to implement SB 100 since December 8th informational review, the department's well on track to licensing all eligible retailers who have applied for TNVP licenses. To that end, we haven't received any further urgent complaints or concerns from industry stakeholders. And if anyone has any questions, I'm happy to take them.
Thank you so much. I really appreciate the update. Before we get into anything, I can say for myself anyway, that I appreciate the effort by the cabinet on this and the hard work that you all have done.
Thank you.
We have someone signed up to speak against. Do we have any questions for the cabinet right now? Seeing none, if you don't mind stepping aside for just a minute, we have Shannon Stiglitz is on the list to speak against. If she's walking forward, so I assume she wants to. Please state your name for the record, and then the floor is yours.
Shannon Stiglitz, Senior Vice President of Government Affairs with the Kentucky Retail Federation. You've heard from us before in the informational hearing. We appreciate it. We think that without your urging, it probably wouldn't have been possible to get as many retailers licensed as we have. I do want to make a note that it was estimated by the ABC's own explanation of the regulation. It's about 7,000 retailers they expect should receive a license. So we still have more out there that are needing to apply. I just wanted to cover two quick things, one of which I've mentioned before. the regulation was filed October 31st. The process opened November 14th. And so, meaning the portal, notice of the portal being open was sent only to ABC existing licensees. That's people who have an alcohol license. We have a significant number of members in dry territories, and the Secretary of State records who sells vape products per House Bill 11 that was maintained in Senate Bill 100. So it should have been an easy opportunity for the agency to get who was in dry territories and did not have a license. But further, one point I did not make last time, and this will be my last comment, is that the legislation took effect January 1st of 2026. And there is some critical language in the bill that states that if you it says a retailer with a license issued by the department and operating under a KRS 243 license, it doesn't say license, excuse me, but it says 243, that's your ABC alcohol license, may initiate the application process to obtain a tobacco, nicotine, or vapor product license on the date of its next renewal. I'm not an attorney, so don't take this as legal advice, but I've read legislation for 23 years now, and when a bill takes effect on January 1 of 2026, but an entity, a retailer, should have been given the opportunity not to have to renew that license until their ABC license comes up, it leads one to believe we should have had a much longer runway for this process. November 15th is right at Thanksgiving time, and I don't care what kind of retailer you are, that is a busy time of year for anyone. And if you were in a dry territory and have had no interaction with an agency called the Alcoholic Beverage Control, that is can be quite intimidating. I do commend and thank the commissioner told me to have my folks call or email him directly, and that is what we did to get through this process. But we do have concerns, in particular, about the enforcement of the regulations as well as the timing of it. But that's all I have. Thank you.
Just stay right there for a minute.
Yes, sir.
Any members have questions? Co-Chair Lewis.
Thank you, Chairman. Shannon, thank you for coming, and I share the sentiments of my co-chair in regards to the agency. We do appreciate the effort being put forward. We did think there would be issues just due to the timing. So my question to you, Shannon, outside of what has happened, and there might be a bill that's getting worked out right now, potentially, is what I've heard. But what do you think the policy should be going forward in the eyes of the Retail Federation?
I think in the eyes of the Retail Federation that this, and I said it before previously, this regulation really treats tobacco like alcohol, particularly 030, that gives the commissioner the ability for anything in their sound deem reasoning, which is in the statute, but goes on to opine that could be based on public sentiment, that could be based on, they think there's too many in there, financial reasons. Some of these reasons I don't even know exactly what they mean, but they're so broad that I think that we think of this regulation as exclusively applying to retailers who solely sell these products or age-restricted products, or and that's just not the case. We at the Retail Federation represent a diverse set of membership who sells these products, and I think, as I said before, some of these were deemed essential. They could be grocery stores, gas stations, pharmacies, and so I think that the enforcement of this going forward could be too harsh, and would treat them unlike the way they should be treated for this product.
Thank you.
Any other members have questions? I've got a couple for Mrs. Stiglitz here. When was this bill passed? When did we pass this bill? Do you have that down?
I don't have, let me see, I don't have the enactment date, but it was,
Our
had to
staff is going to
adjourn.
get that real quick.
You
They-
had to adjourn before the end of March, so it would have been before. then.
25?
Correct.
Right.
Yes.
So that would have, normally if we pass it in 25, it would go into effect June 30th of 25.
Mm-hmm.
But we specifically put in there a delayed implementation date, correct?
Yes, sir.
So the delayed implementation date was January 1st, 2026.
Yes, sir.
I think that's what the
On,
cabinet just
on
stated.
those sections that relate to licensure, yes, sir.
So the cabinet, and we can talk about this more when the cabinet comes back up, but so in other words, the cabinet wasn't blindsided by the implementation date, right? So sine die 2025, you've got 6-7 months there of runway, and then you've got a 6 months of time where it could have been implemented. And so, what's your opinion? I'm sure you have opinion on this. What would have been the number of how much could we have gotten across the line quicker? So if this went into effect, the regs and the implementation, if it was gone into effect like July, wouldn't that have given your people a lot better?
It would have given our people a lot better time, but I would argue that these regs were promulgated prior to the effective date for these sections, which could have been done earlier. And I would make a note that we'd reached out to the agency on multiple occasions after the passage of the legislation to ask where we were in the process, how can we partner with you as you go through this regulation development. And we did receive response, but it was, we're working on it. And I think that the comment was specifically related to the portal and the technology. But yes, I think that we could have handled this much better, especially in light of the effective date and that language contained in the legislation.
Yeah, what is your opinion on the universe of businesses that are still out there, unlicensed? What do you have any idea of numbers? What those are?
We, based on the numbers that we don't get daily updates every day. Our best guesstimates is based on what wholesalers tell us. As going into January, it was only about 40% had it, but based on this number, it sounds like maybe we're down to 2,000 or so that don't have a license or haven't applied for a license, based on the ABC's numbers.
And your reasoning is they haven't applied because many of them don't know about it?
I would
because they're
say
in dry
that
counties?
they maybe don't know about it. I can only comment on what the comments I've received back. They are getting, if they're in a dry territory, they don't have a license, there is a 10-day reprieve, which is helpful to them. But yes, I would say lack of communication would be the primary reason.
Okay. Anyone else have questions for Mrs. Stiglitz? Okay, if the cabinet would come back up, please. Would you like to respond?
On a few points, I think we could respond on the initiating at their next renewal. There was only one part of the statute, part of the bill that says when tobacco retailers have to have their license, and that is January 1st. If the people are, alcohol retailers, licensed alcohol retailers were allowed to continue until they started their application, or the application was to, I guess, be approved. If they were, there's no real way for us to have provided the to know when the deadline for alcoholic beverage licensees would have been, when they would need to have the the retail tobacco license. And because of that, we only had the January 1st date to go by. And so we believe, and the way we interpret this is that every tobacco retailer needed to have their license as of the 1st. So that was what we were operating with. It was well within the statutory guidance that we were given. As far as public sentiment, I wanted to address that. There was a suggestion that the inclusion of public sentiment among the discretionary factors to consider. Those were all, as Ms. Stiglitz mentioned, those are all those came from the alcoholic beverage license denial statute. However, I did want to say that while some of those may or may not fit, we are currently meeting to discuss, and we have asked for input into what sort of factors should be considered. Public sentiment specifically, though, is something that we believe the legislature intended for approvals and denials to be based in, because the transitional license itself requires that the applicant for a transitional license put a public notice out. And if people are being given public notice and a chance to comment, if they are being given a chance to comment and we aren't supposed to consider their comments, it seems kind of fruitless for them to do that, and for the legislature to have put that into the bill. So we do believe public sentiment was intended to be a reason why a tobacco license may be denied. But again, we are open to, and we put into our statement of consideration that we are requesting any further comment on what factors should be included in the discretion. We didn't receive any further comments on that, but I did want to mention that we did offer that up.
Got it. I just have a couple questions before I chime in. Any members have a question for the cabinet? Seeing none, my two questions revolve around the TPLs, provisional licenses. Explain when that occurred. Remind us of when that occurred and how that occurred.
You're talking about the provisional license?
Yes, the provisional license.
That is a separate emergency regulation that's 804 KR 13025E, I believe, and that occurred. I think that was filed on the 22nd. Or maybe it was the 20. No, I'm sorry. I think that would have been right after Christmas. It was like the 20.
If you could hold on just a second, I'm going to talk to the expert.
Okay.
On this.
Sounds good.
and get my chronology right on that just a second. The committee will stand at ease. No, take your time. She's doing some work here real quick. I've got moving on to my second question. Where did the statutory authority come from to do the TPL? Are we sure we have the cabinet has the authority to even do that?
I believe we drew from the statute. I think it's 438-3055, essentially saying. What is it? Division. It talks about a division of tobacco, nicotine, and vapor product licensing shall carry out the enforcement provisions of KRS 438-305, 438-305 to 438-350 as they relate to the regulation of alternative nicotine products, tobacco products, and vapor products, including promulgating administrative regulations that govern the sale and distribution of alternative nicotine products.
Kind of the catch-all.
Yes.
Yeah, gotcha. Any others have questions? We got to do some bookkeeping up here a little bit and do a few things if the committee will stand at ease. I apologize for the delay on that. Any other members have questions? At this time, I'm going to have a motion. I'm going to have a motion for deficiency on KAR 013020E and KAR 013030E.
Second.
Do we have a second?
Second.
Co-Chair Lewis is a second. Is there any discussion on a motion for deficiency on these two regulations? I'll just explain my motion. This is a major bill. This is a major sea change. This is a major undertaking for the cabinet. And so we understand that this involves a lot of moving parts. For a lot of people, this is in the law, you call it a case of first impression. So this is the first time these entities have been licensed in this way. We have thousands and thousands of businesses out there who need some time to adjust to this new framework. Once again, we appreciate the cabinet making the effort to do the transitional provisional licenses. So we're not touching that particular provision. But we do believe there are a couple bills in the legislature that will attempt to clean this up a little bit. And this motion for deficiency is just an effort to give people more time to get their act together and get licensed. And so that's the purpose of the motion. Any other discussion on these motions? Seeing none, the question is on the motion to find the regulation deficient. All those in favor of finding the regulations deficient will vote aye. Those opposed will vote no. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Wilson. Representative Bridges.
Aye.
Representative Gordon. Representative Marzian. Co-Chair Lewis.
Yes.
And Chair West.
Aye.
We have 5 ayes, 1 pass.
The roll call shows 5 members voting aye and 1 member voting pass. The motion to find these regulations deficient has passed. Thank you to the cabinet. Appreciate it. Up next on the agenda, we have the Board of Veterinary Examiners. If you would come forward.
Board of Veterinary Examiners, 201 KAR 16 730 731 732 735 737 767 772 775 and 777. 201 16 730 735 772 775 and 777 have staff suggested amendments. Regulation 201 KAR 16 762 was withdrawn by the agency this morning, February 9th, 2026.
For the AAHP regulations, 201 KR 16730 amends to establish requirements for AAHP equine dental provider license and list board-approved programs for equine dental providers. 201 KR 16731 amends to require a unique jurisprudence exam for each provider type and require an applicant to successfully pass a board-approved national qualifying exam. 201 KR 16732 amends to require legacy candidates to comply with all provisions of an AAHP license, including continuing ed and establish EDP application requirements. 201 KR 16735 amends to establish continuing education requirements for chiropractic and dental AAHP licensees. 201 KR 16737 amends to require AAHP licensees provide only services to the species which the licensee has training for, provide licensees with a list of prohibited practices, establish conditions upon which an EDP licensee may supervise students, including limitations, establish requirements for supervising veterinarians, limit an EDP student from practicing 6 consecutive months on live privately owned animals, and establish dental chart requirements. 201 KR 16772 amends to include minimum requirements to operate an AAHP facility and require mobile units to have a registration certificate. 201 KR 16775 amends to specify information needed on the legal business name. 201 KR 1677 amends to limit an AHP manager to managing no more than 5 registered facilities with any affiliated mobile units counting under their primary facility, and require an AAHP manager to visit a facility enough each month to have sufficient knowledge and control. The staff amendments for 201 KAR 16030, 735, 772, 775, and 777, and the amended after comments versions for 16731, 732, and 737 amend various sections and incorporated material to comply with KRS Chapter 13A. Additionally, the amended after comments version for 16737 amends Section 51D to change examinations to observations, amends Section 51J to clarify records contain the name of the AHP provider, and amends Section 52C to add the route of drug administration to be recorded.
Veterinary Facilities Regulation 201-16767, as initially filed, requires the physical presence of a veterinary manager for a time sufficient to have knowledge of and control over the facility's compliance. Limits a vet manager to no more than 5 registered facilities, with multiple mobile units constituting 1 registered facility, and updates incorporated material. The amended after comments version clarifies calendar and business days for reporting requirements and makes technical corrections.
You guys have been busy. Please state your name for the record.
Michelle Shane, Executive Director for the Board.
Dr. Is that on?
Yes, I can hear it. Yes.
Dr. John Park. I'm an equine veterinarian in Paris, Kentucky. I'm chair of the Board of Kentucky Veterinary Examiners.
Thank you so much. I just have to share this. One of our committee staffers, I won't say who it was, said this meeting has been like herding cats. And I thought that was fitting for you all. We're going to talk about that. I think they were also talking about the legislators as well. It wasn't just the people out there. So we have, let's just cut to the chase. We have two regulations in question that there's been some kind of back and forth on, okay? You all have withdrawn 201 KR 16762, but I do want to open the floor up. If you would like to discuss that regulation, we are open to doing that at this time. It's your choice. If you want to speak about that, you can. If you don't want to speak about that, it'll go through the process. Go on to the next step. But that's up to you. I'm going to give you the opportunity. I'm just talking about 16762, basically the space requirements in facilities. So the ball's in your court.
I'm happy to address that just because there's been so many questions in this area. So we'd like to
discuss.
Provide the folks here that have traveled the opportunity to talk, and then also give you all some foundational background there.
The floor is yours on that.
Thank you. So 16762, we did withdraw this morning because of the feedback we've been receiving on it. One of the areas of concern, the board did go through the public comment period, received a number of comments. We even accepted comments, I think 20 days later, past the deadline in order to facilitate transparency in the process, and filed extensive SOCs in response. But there were a number of areas where the board identified concerns, and we wanted to highlight those for the committee. Number one, are pop-up clinics being prohibited? And no, that is not the intention of the board. The board does not want to prohibit services to clients, only to ensure that services provided meet basic minimum requirements for care and operation, just like any other veterinary facility. We want to ensure that there's continuity of care. Some of the applications that we've received on facility locations identify after-hours care at facilities that do not exist in Kentucky or that are much further away than other available facilities, and this is a concern for the constituency and their animals. Does this prohibit in any way rabies vaccine clinics? No, that is CHFS, public health law. This board is not in any way trying to prevent those, and there is exemption that exists in the law to continue to allow rabies vaccine clinics at that low-cost $10 price point. And we just want to ensure, too, that client education and disclosure is upfront and equitable amongst all veterinary facilities. There were other items related to comments on human vaccine comparisons and costs of veterinary care, which we believe is better addressed by the KVMA.
If I could just add a few comments to that on the dedicated veterinary space. We want to ensure, our mission as a KBVE is to license veterinarians and to carry out the will of you, the legislature, for the statutes and regulations, and to have protection of animal and the public that owns the animal in that setting. And, so we want to stay in our lane, and we try to do that and work hard to do that. The maintain the control of a patient or a dog or a cat in those retail public settings. We feel the dedicated space is safer for public that may be shopping for clothes or doing something else that doesn't have an animal with them. And I'm going to give you, just for an instance, I'm an equine veterinarian and handle 1,000 to 2,000 pound horses constantly, but I've got a German short-haired bird dog that's the best dog in the world, and if I brought him in here today and told him to sit right there, he'd sit just like a person and look at you and do whatever I tell him to do, not because he's mine, but he's just that unique individual. But I'm a veterinarian. Now, if I go to trim his nails, he's going to hit all 3 of those rails and be sitting in your lap. Boom. If I go to give him a vaccine, he'll run through those curtains. And so it's Katie bar the door for a simple shot or just a toenail trim. So this is just an example of the situation that it can occur in retail space for safety of the person that's handling the animals, the staff, or the public that's in that area shopping. And so that was some of the basis behind the dedicated space for privacy, for animal protection, for human protection. And so we don't feel that's out of question or out of reason to have a dedicated space in a retail shop. If you go into PetSmart, the Banfield model of clinics is walled off and separate in rooms. If you go into your veterinarian clinic in rural area, urban area that's a dedicated veterinary clinic, there's exam rooms that are contained, that the examination is done in. And so what we feel, we don't want to limit veterinary services in no way. It's important that all animals and consumers be able to have veterinary services. But I think what the focus is we want that continuity for anybody providing veterinary services, whether that's in the hollows of eastern Kentucky, western Kentucky, or urban areas, to be on the same playing field for the standards of care, for the consistency, and that those are enforceable by this board for the animal protection and the public protection of the consumer. And so I just want to say that for a basis for that dedicated veterinary space. And I hope you see our perspective. And I know there's multiple perspectives, and I have great admiration for you and your job, because there's your constituents you're dealing with from your home district, there's us, the interest, there's special interest lobbyists, there's the boards, all these different facets. So you guys have a lot coming at you, and I respect that. And we as a board of examiners want to stay in our lane but provide the protection, number one, for the animal. That's our utmost mission.
Gotcha. Great presentation. I'm going to take a brief pause here. Just stay right there. I've got to go back and clean up a mess that I've made. So back on the ABC regs and tobacco, I made a mistake. We had some people here signed up to speak in support of, and I did not see that on the sheet, and I totally apologize to there were 4 people signed up to speak in support of. I can't fix it now, but I just want to apologize and let you know I made a mistake. It was my fault. I didn't see you on this sheet, and I apologize for that. We have several speakers for and against this, okay? And so to keep this organized, we're going to jump ahead a little bit, okay? We're not going to do any motions at this time or anything like that, but let's move ahead to 201 KAR 16767, and then let's just talk about that, okay? So the floor is yours. Go ahead and talk about what's in the reg and what's your opinion of that.
Thank you, Senator West. The agency intends to ask for deferral today on this regulation to allow us some more time to work with the stakeholder parties to come to a consensus agreement on what might be a more appropriate approach in this regulation to ensure appropriate manager oversight in all areas. That's going to include not just management of personnel, but the facility's veterinary protocols to ensure they have all the correct equipment for the services being provided, and correct any deficiencies in compliance. And just for an example I would like to provide, we know that there are a number of pop-up clinics that occur all over the state. We did send an investigator out in one case that was assigned a grievance number, and that investigator identified multiple problem areas related to compliance with current statutes and regulations. And we believe that a manager who was familiar with the on-site situation would have been able to correct those deficiencies. And that was just one site of the many we know that are out there. Dr. Park?
Yes. The initial proposed regulation, sought to the number 5 as the number of facilities a veterinary manager could oversee, and not have to be present, all the time, but enough time to have sufficient knowledge of the workings of that clinic for the standards of care and the medical procedures. And we're willing to go to the table and talk about that number, but we feel that they're in the SOCs. I think Michelle can correct me if there's wrong, but the request was for 84 stores or facilities for a veterinarian to be listed as a manager, and we feel that's a little extreme. The compromise could be met somewhere, and I can tell you from a business owner of 2 large equine hospitals, 2 was enough for me. And so we just again go back to that animal and public protection of what's reasonable for a veterinarian to manage that has knowledge of the standards of medical care and the inner workings of those facilities.
Gotcha. Brief pause here. Announcement. The speakers on the ABC regulation. After we're done with the veterinarians, I'm going to allow you guys to come up and speak in favor of it. And this question is not over. It's going through the legislature right now. There's a couple bills on it. So I'm coming to you here in just a second. If you want to stay, don't leave yet. You'll get your bite at the apple. Thank you guys for that presentation. Stay right there. We've got multiple speakers. Now I'm going to bring up the.
Can I make one more comment?
Sure.
Real
Yes.
quick?
Yeah.
And I just wanted to say during we followed the public comment period from August to September, and as Michelle stated, we even accepted up until October 20th a late to show good faith and judgment, and we responded to all those in the SOCs, and I'm unaware of any request of stakeholders to come to the table for private meetings to try to talk about that with us. I want that for the record. We're open to that, but we didn't have any request before today, if I'm aware of.
Yeah, post filing of the statements of consideration.
That's good to know.
Yeah,
that is good to know.
Thank you.
And duly noted. I'm going to bring forward now. We have a couple. I have a couple on my. You can stay there, Dr. Park, for now.
Okay.
We may need to pull up another chair, but right now all I've got is 2 people speaking in favor. I have Wade King and James Beckman. If you want to come forward and speak. There may have been 1 or 2 others to speak in favor. Now is your time. I don't have them on my sheet. Is there a Shannon Baker that would like to speak in favor? Going. That's you don't care about vet regs, do you? Okay, this is sorry. Gotcha. So I think we're organized. Please state your name for the record. Make sure that green button is on the microphone. Both of you state your name for the record, then proceed.
I'm James Beckman with the KPPA. I'm current president and equine practitioner, mobile veterinary practitioner. So I have a little experience in this. I'm here today to voice my support of Reg 767. We're asking for the facility managers to be able to provide reasonable oversight. The purpose of these regs is to protect the public. These facility managers need to be provided the ability to ensure the facilities are being managed within the regulations that they've set forth. The number of veterinary practices being managed needs to be reasonable. Can a manager adequately ensure that 10, 20, 50 veterinary practices are all following the rules, are all within the regulations, and all providing standard of care? I don't know what that number is. I'm going to kind of leave that up to the KBVE. They're the ones that have the experience and they know what they're getting into as far as inspecting all these facilities and enforcing all these regulations. I just know that these facilities managers need to be able to be reasonably tasked with these jobs. None of us need the job of inspecting 82 or 84 veterinary practices and making sure that they are within all of the regulations at all times. That it's just not reasonable. They need to be, these managers need to know, they need to be able to ensure for the public. That's the whole purpose of this, is to protect the public. They need to be able to ensure for the public that they're able to track the disease outbreaks. They need to be able to track and distribute medical records for every one of these practices and every one of these visits. They need to be able to track human exposure to diseases and coordinate with public health departments at all of these different counties around the state. That is part of their job, is to be able to pass along that information and to coordinate with them. They need to be able to ensure drug safety and security. We all know in this current environment, veterinary drugs, we need to make sure that we have them secure and safe. And these managers need to be able to ensure that on every practice that they are managing. They need to be able to ensure that the facilities meet the minimum standards for all veterinary facilities. These are not just rabies clinics like we used to. These are actually pop-up veterinary clinics. So they need to be able to make sure that all of these managers need to be able to make sure all of these facilities meet these regulations. There's a little bit of an issue with these, part of the nature of the beast of this is that these are temporary facilities. They're temporary veterinarians, and they're temps. Some of them work there a lot for a long time, but I would imagine, and I'm sure we can get that information, but the majority of these veterinarians, they come in, they do their job, and they leave. They have no idea, no continuity of service. They have no idea where those records go when they're done with them. They have no idea where those patients go when they're done with them. And that's part of it, but we need these managers to be able to control those facilities a little bit.
Hi, my name is Mark Chick. I actually said I was against it, and I meant to say I was for it. I got confused on that. So I'm a small animal veterinarian in LaGrange. I actually work across the street from one of these, and less than a half mile down the street is another one. And, I agree. Everything James talked about, I agree 100% with. There's just no way to be able to manage large numbers of facilities the way they need to be managed. He was talking about, aftercare, after the vaccines are given. There's nothing that they have support with these facilities. I'm generally their support when it comes to aftercare facilities or emergency clinics that some places don't have. These managers with large numbers do not have. There's no way they can have knowledge of the working protocols that are occurring in each of the facilities. I've been into these places. I see lines of dogs with kids, other customers, walking around the facilities, and like Dr. Parks was saying, not every dog or cat, and I can't imagine having a cat in one of these things, but not every dog does great. Most of them, probably higher majority, give us problems, and it's just the unknowns there. It's just the safety of the pets, the safety of the owners, the safety of the public in general. It's just concerning when you have to control that large a number. So, in just again, the record keeping is just something that would be very difficult in these situations.
Thank you so much for the presentation. Stay right there. We're going to split this up. I'm going to go ahead and take an initial round of questions, and then we'll have those signed up to speak again to come up next. Any member have any questions for the board and people in favors? Seeing none, if you don't mind stepping to the side a little bit. Those signed up to speak against, if you could come up at the same time right now. I have Catherine Fleer. Are you by yourself, Catherine?
Yes, Katrina.
Katrina, I'm sorry.
That's okay.
I'm not doing very good with my sheet today.
It's
I
a common
apologize.
mistake. It's not a big deal.
I apologize. Make sure your green light's on. State your name for the record correctly. My fault. And the floor is yours.
I'm Dr. Katrina Fleer, Medical Director for VIP Pet Care. So, good afternoon, y'all. So, VIP Pet Care has operated mobile clinics providing preventive care to dogs and cats in the Commonwealth of Kentucky for over a decade now, without incident. We do operate in 84 locations in Kentucky, many rural areas, and we've served in that time over 83,000 pets. So we do a lot of work here. I really appreciate the opportunity to address the pretty devastating impact that the proposed amendments to this regulation would have on our existing clinics. Frankly, we'd be forced to cease operations in 94% of our clinics. We would just have to stop. That's 78 clinics we'd have to close down. And the valuable service that we provide would be lost to pet parents in Kentucky. There is a known and published vet shortage, not unique to Kentucky, certainly, but also certainly present here. Facing the impact of that shortage, we choose to operate on Saturdays and Sundays when many other clinics don't operate, so that we can reach those Kentuckians that might be limited by work, transportation, kids during the rest of the week. We have provided all supplemental material requested by the Kentucky Board of Vet Examiners and answered all concerns discussed in their meetings. We've also provided each of you with a detailed response to each statement of concern made by the board in support of the proposed regulation changes. I think that you'll find in that response questions or answers to many of the questions just brought up by the other two veterinarians. So I won't go over those now unless you have further questions. So just to reiterate quickly, VIP Pet Care has been operating in the Commonwealth of Kentucky for over a decade, helping prevent disease in 84 locations across 50 counties without a single complaint regarding human or pet safety during that time. I am super proud to have been present every step of the way, and I hope we can continue to offer our services to the great people of Kentucky and the great pets of Kentucky. We are certainly willing to work with the board on a compromise, and I'm happy to answer any questions that you guys have.
Perfect. Any members? I've got a couple questions. Any other members have questions first? Seeing none. What is your estimate of number of cases in a year, like an annual? Just a guesstimate is fine.
I'm sorry, cases of what?
How many people? How many pets or people do you see in a year?
We estimate about 7,500 per year.
Gotcha.
Yeah.
And so, if you were forced to shut down, then the great majority of that would
Would go away.
Would go away, right?
That's correct.
Right. They would have to see our current providers if possible.
Yeah, and some people just simply can't make it, or they like the convenience of being able to come into a retail location where they can also get their pet food and their chicken feed and whatever else. So we do have a lot of people who come to us because of convenience, and they want their rabies vaccination at the same time. So I get it.
So you stated that you would have to close up shop basically if this
Correct.
particular reg went through, basically mandating a manager of a certain number of locations. Why do you say that? Why would that? Is it basic economics, or give us a little bit more detail on why you think that's
Sure.
true?
Yeah, so I am the veterinary manager for the Commonwealth of Kentucky, and most of our veterinarians that work, we always have a licensed veterinarian at every single clinic, but they are contracted, so they are not employees. So everything that way just gets kind of funneled through me, so that there's, a consistent message to the board. I spend a lot of time in Kentucky. I'm always available by phone. So, and our clinics do only open for, they're open 2 hours at a time. So it sounds like we have a lot of clinics, but they're not open for very long.
Is it a couple times a month generally? Is that?
It's either, depending on the demand in the location, it's either once a week, once a month, or like you said, twice a month.
Got it. Got
Yes.
it. Do you wish to state anything else? Any questions from members? Senator Adams has a question.
You stated that you would be open to working on a compromise with the vets. Have you initiated any sort of conversations?
We have not, but we will.
Okay, thank you.
Yes.
Any other questions? Anything else you wish to add?
Not at this time.
Okay, great. I'm going to bring the board back up. Just the two of you, if you could come up.
Thank you.
You're welcome. Thank you. I just have one question. Do any members have questions of the board? Seeing none, respond briefly to that idea that, if they're currently treating 7,500 animals and they go away, and that pushes, let's say that pushes, pick a number, let's say that pushes 7,000 animals into our vet practices, and we have a vet shortage, how's that going to work?
So I think there's a couple components in response to that. In part, we're not, as a board, trying to prevent the provision of services at all. We just want to see them done correctly and with patient and public safety foremost in mind. And I would like to say that low-cost clinics are available in other places. This rule doesn't, there are exceptions for partnering with local health department, providing rabies and other zoonotic disease vaccines. But what we've seen in the business model that is being discussed right now is an expansion of services beyond just vaccines. Now we're getting into diagnostics. Now we're getting into prescriptions. And these are things that need more long-term veterinary oversight for the patient. Dr. Park, would you like to add?
Sure. I'm pretty quick on math, so the 7,584, that's around 90 patients. If you look at that, 7,500 a year, 84 locations, around 89 or 90 animals. So, and it's twice a month over those locations. So, to answer your question, let's just talk about Bourbon County, where I practice. Tractor Supply, or a location that has the monthly or bi-monthly or those kind of clinics. There's 4 or 5 small animal clinics within a mile of there. So I don't know about all locations, but I think one of our things in the Practice Act and the registering facilities is to get an idea where all the facilities are, and that way we can better help with the areas that need veterinarians to provide you the data where the shortages are. And then, on the cost, we don't get into the cost of services. It's a free market, and that's not our lane. But I do think that to answer your question, there's a lot of small animal clinics in certain areas where these are located, as you heard from the doctor that was up here previously. And I don't know, am I allowed to ask a question or to the constituent veterinarian, or is that acceptable?
I would say, this is my opinion, save it.
Okay.
Yeah, you certainly can.
Okay.
This might not be the best. If we were going to roll on down the road with something either way, I'd say go ahead. But I would just say save that for.
Yeah. So then
we'll be back here next month.
Okay.
And so.
So one more comment on that is.
Sure.
And so they've stated that most of those are contract veterinarians, and so they may work by the day, they may work by the hour, or contract and go in. And those contracted veterinarians probably don't have much say on the standard of care, the medications, the things that occur to treat the animals, where the veterinary manager will probably set those precedences. And so when you're the veterinary manager for 80 plus locations, that seems a little extreme. And so we're willing to compromise. And again, she stated the answer to the SOCs, or maybe Michelle may have to help me here. We would have been glad to see those comments that she gave to you. We didn't see. So it's a two-way street. So we got to know before we can compromise. Yeah.
And that's a very common thing in this committee. That's the purpose of this committee,
Gotcha.
To bring people together. So
Last-
we're all in this together, right? Heard that somewhere.
Last point, just for your consideration, is that we did look back at grievance cases from June 2020 to February 2026 and identified 25 cases related to low-cost service providers. 4 patients died in those cases. Other clients had to spend additional money that was unanticipated to get problems corrected or emergency services for the patient. So to say that there's been no complaints, I recognize they might not have received some, but this agency has.
Thank you so much. We could go on, but we'll be back here. We're gonna leave it right there for today. There are staff amendments. Is there a motion for approval of the staff amendments? We have a motion and a second without objection to so ordered. So we have before us the regulation as amended. Circling back to the beginning, there has been an official request for deferral by the agency. Is that correct?
Yes, in 16767.
Yes, let's be specific. For 201K or 16767, there has been a request for deferral by the agency. I make a motion that we do that. We have a second by Co-Chair Lewis. All those in favor of the motion being accepted say aye. Opposed, nay. Ayes have it. Without objection, it is so ordered. The regulation is deferred.
Thank you.
Thank you so much for being here today and talking about this. Now I'm going to give my standard admonition. Could the two groups please work together and communicate and try to work out a compromise?
Senator West, will we see the Allied Animal Health equine dental provider regs be made to go forward?
Okay.
That was that second group of regulations that we had up. The 730, 731, 32, 35, 37, and then 772, 75, and 77.
Hold on just a second. That was such a long list at the beginning. I don't know if she called them or not, but if she did call them, it's included already.
Okay, great.
Did we call them? They have been called, so it's all included.
Thank you so
you're
much.
good to go. Yeah. All right.
So are those deferred or are those passed?
But by not saying anything, they automatically move.
Okay,
Yeah.
thank you so much.
Yeah, you're welcome.
Thank you, committee.
Thank you.
Yeah, you're welcome. Now we're going to circle back. I'm going to do some housekeeping and attempt to partially correct an error. If the four individuals who were going to speak in favor of the ABC regulations would come forward, We have Shannon Baker, Zachary Crouch, Kristen Jemison, and Kisnia Miller. Ksenia, I apologize. If you would, when you get ready to speak, please state your name for the record, make sure your green light's on, and proceed.
Thank you, Mr. Chairman. To add further confusion to the day, I'm the other Shannon in the room. I'm Shannon Baker, Director of Advocacy for the American Lung Association in Kentucky.
And to be clear, you're not here to speak about veterinary regulations.
I can if you like, but I'm not well prepared. Ksenia, go ahead.
My name is Ksenia Miller, Kseniamiller.
My name's Zach Crouch, and I'm the president of Taylor County Youth Coalition.
Hi, I'm Kristen Jemison. I am Regional Advocacy Director for the Mid-Atlantic for the Campaign for Tobacco-Free Kids.
Start us off.
Good morning, members of the committee. As I've already stated, my name is Ksenia Miller, and I'm a resident of Kendon County as well as an advocate for youth nicotine prevention, and I'm currently serving as the National Youth Ambassador for the Campaign for Tobacco-Free Kids. And thank you again for offering me the opportunity to speak today. The issue of nicotine in commercial tobacco has unfortunately persisted for generations, but now new products such as nicotine pouches have emerged. E-cigarettes alone have targeted our state's youth for years, leading to an epidemic of nicotine dependence that continues to damage the futures of my own peers. Kentucky's high density of tobacco retailers, targeted advertising through media, and previously unenforced laws surrounding minimum legal sales age on nicotine products has consistently caused students to fall into the trap of thinking that nicotine can serve as a tool to alleviate the immense stresses of high school. In reality, the damages of nicotine dependence and the multitude of horrifying chemicals within e-cigarettes has proven to lead to a lifetime of negative effects. With the development of nicotine pouches, this historic issue is persisting to threaten the lives of my peers as it has done in the past. My personal interest in this issue started in elementary school, when I continuously watched my family members struggle with the effects of both first and secondhand smoke. But after deepening my knowledge about Big Tobacco's tactics to create lifelong customers at the expense of our society's health, I felt appalled. All this inspired me to stand up for the passage of tobacco retail licensure in Kentucky. After months of hard work, myself alongside youth advocates from every single part of the state were a driving force behind the passage of Senate Bill 100, which was a crucial step to prevent nicotine dependence for peers. But it has also shown Kentucky's exceptional leadership in public health and protection of our youth. Others have even looked towards our youth-driven initiative as a model for their own states, and it felt incredibly empowering to know that my voice, alongside dozens of other students, was being prioritized for the sake of Kentucky's kids. I urge your support and prioritization for this regulation by requiring this new licensing law. Our state simply cannot wait any longer. Students are struggling with nicotine dependence every hour of the day, which infects all of our other aspects of life, ranging from educational success to positive well-being. If action is not taken now, the futures of hundreds of students will become damaged for years to come. SB 100 is set to start protecting kids now, and the facts are clear. This issue can be overlooked and repeated again and again behind closed doors, or actions can be taken now for the sake of a healthier future. We're counting on you to put the needs of these students and future change makers first through your investment in this regulation. Thank you.
Hello, I'm Zachary Crouch. I'm the president of Taylor County Youth Coalition, which is a local coalition where I'm from. And we do surveys often around our community. And I'm here to tell you some of the things that we see and to urge no more delays on. So what we see a lot of is a lot of questions that we get is how young do you see it? And, we hear a lot of high school students, freshmen in high school. But during one of our surveys, it actually went as low as third grade. Nicotine products were being used in third grade. in high school in the Commonwealth. So I think that should urge some importance behind that. And during the surveys that we have on the retail stores, we've seen gambling push machines where you kind of get the quarters and you push them in and it pushes more quarters out. But there's things like DAP pens and e-cigarettes and packs of Zens in there for kids to win. And something that I'd like to bring to your attention is, as a kid, I know when I was younger, that if you saw quarters on the side of the road, you picked them up. And so these kids that are picking these quarters up, if they go into the retail store and they just put them in there to play the game, they can get a vape out and just take it up to the counter and walk out. And so, and they look at it as a game, and you guys as adults and us as young adults look at it as a problem. But they don't understand that yet. And they definitely don't understand what nicotine does to their body and to their mind. All they see it as is a game. And, this, you could see it as off topic, but one of our friends from school, a lot of people think that, a nicotine addiction can be easily solved and it's not a big problem for the youth. But he actually started with nicotine when he was a freshman in high school, and he graduated high school and made a comment to me that he was wanting to start hard pills and heroin just because he couldn't feel anything from the addiction that started with nicotine. So I think that when you don't start with nicotine, we don't think it's a big deal. Some people don't think it's a big deal. It can push you farther down the road than you thought. And that's why we really push for licensure to be, enforced now and no more delays. And, in Taylor County, I think I can make the claim it's easier to get an e-cigarette than a candy bar at a gas station. And that's only because when you go into this gas station, all you see is nicotine products. You see it on the counter. You see it in the shelves by the donuts. You see it in the shelves by the candy. You see it in the shelves by, like, where you walk in, it's underneath the cash register. And most of the time, these people aren't paying attention to who walks in the store and where they walk around to. It's easy to pick up. It's never, most places in Taylor County, it's not placed behind the counter. It's placed in the store at eye level with bright colors and almost advertisements for youth, like little YouTubers or other things like TV shows or commercials, Labubu dolls, other things like that is one thing that we really see. And it's not just vape stores or vape shops. It's mom and pop stores, little retail places, or big chain retail places that are doing this. And it's not okay for us because it targets us directly. And I think that's overlooked when we want to push back the licensure. I think they target us directly, youth and my peers. I think that it's hard to say no to that when you've been targeted for it for years and years.
I'm Shannon Baker, Director of Advocacy for the American Lung Association in Kentucky, and we've talked earlier today about how long ago SB 100 passed. Let's look back even further in time to when we passed Tobacco 21, the law that prohibits underage sales, fully 6 years ago, and we're still talking about effectively enforcing that law. It's an abomination that kids are still able to access these products, and so I would suggest to you today, no more delays. As Ksenia and Zach have said, we can't afford to kick this can any further down the road. One more day is one more and one more and one more kid we lose to nicotine addiction. The time to move forward is right now. In addition, since the regulations are going back to be reconsidered, let me suggest we need to make a deliberate effort to identify the total universe of these nicotine retailers. And so today we heard that as many as 5,500 applications have either been approved or are pending. We've also heard that there's an estimated 7,000 such retailers in this state. I have heard from agency staff that number may be 10,000 nicotine retailers in Kentucky. The very reason we passed tobacco retail licensure is because we just don't know. We needed to establish the physical location of all of these businesses in order to be able to go in and conduct random, unannounced compliance checks to ensure that these retailers are not selling to kids, and when some are, there need to be some real meaningful penalties in place to discourage that kind of behavior. We need to identify the total universe of the nicotine retailers in Kentucky. So let's think about the fact that we know some are illegally selling to kids today. Do we think that those retailers are inclined to apply for a license? I suggest probably not, maybe not at a minimum. So the regulations need to contemplate a way to reach out into the community and proactively identify retailers, because that's where we are likely to find the actual bad actors. In addition, third and finally, I would suggest we need to proceed with random unannounced compliance checks, again, without any further delay. We have the ability to move forward right now. We just heard earlier today there are 5,000 new licensees in the state of Kentucky. It'll take more than a minute to go in and do compliance checks. Let's start there. And then we can continue on a parallel path, can't we, to identify all the other retailers in Kentucky. So I should have started by thanking all of those of you who voted in support of SB 100 in 2025. We appreciate that support. We appreciate the prior support of the Tobacco 21 law. And so now we know the legislature has the will to stop illegal sales of nicotine products to our kids. Let's do that now.
Thank you, members of the committee. I'm going to go last, and I will be brief. As I said before, I'm with the Campaign for Tobacco-Free Kids, and first we want to thank legislators in Kentucky for taking this common sense approach to reducing the harms of nicotine use among Kentucky's children. We appreciate this committee's acknowledgement today of the crucial importance of safe regulation of tobacco, nicotine, and vapor products. I do this work regionally, and I did want to share that Kentucky's being used as a leader and a model nationally for this type of legislation in several states, including Tennessee, North Carolina, Virginia, and South Dakota. We believe that the new tobacco retail licensure laws provide the necessary framework to help prevent sales of any nicotine products to children. When the new regulations are finally promulgated, we believe they will stop bad actors, limit youth access to harmful products, and protect retailers that are being responsible by enforcing the law. Before licensing was adopted, agencies responsible for enforcing youth access laws lacked a dependable way to determine which businesses were selling products and where they were located. ABC has indicated publicly that the number of retailers statewide could be as many as 10,000. Without a reliable system for identifying those businesses, enforcement efforts have been limited. We appreciate the efforts to establish procedures to notify retailers of their obligations under the law, including steps outlined in connection with emergency regulations, and we encourage a comprehensive approach for identifying all retailers necessary to ensure meaningful compliance and prevent unlawful sales to minors. We welcome ABC's commitment to reviewing and updating its existing retailer list. At the same time, the success of a licensing system, as we've seen in other states, depends on more than voluntary participation. If retailers do not come forward or do not know to register, the list remains incomplete. In addition, we encourage provisions that promote public awareness, including the use of media and community education, so residents know how to report illegal sales and bad actors. Reports from the public should result in timely inspections with follow-up visits when violations are found. Retailers identified through complaints or enforcement action should be subject to inspections as well. Finally, we encourage that enforcement begin right away. Delaying compliance checks or allowing a grace period would undermine the intent of the law and leave Kentucky's youth exposed to more risk. Thank you.
Thank you so much for all of your presentation. Once again, I apologize for not seeing you on the sheet at the beginning. Do any members have questions for this group? I've got a quick question for Mrs. Baker. On the tobacco 21 legislation, is it your position that it's not currently being enforced properly? Is that what you were stating there?
So the Tobacco 21 law was never enforced absent tobacco retail licensure because we didn't have the physical locations of all the retailers that sell these products. So while enforcement activities have been underway historically, they have been incomplete.
Gotcha. I missed your point on that. You're not saying it's not being enforced. You're saying there are people flying under the radar and we don't even know if they exist, so they cannot be enforced. Gotcha.
Yes, sir.
Gotcha. thank you for your presentation. As stated earlier, you should take solace in the fact that we do have a bill that has passed. There's a couple bills in the legislature right now that address this topic, and we do have several businesses licensed, as we can see, that have already been through the process. But ultimately, this will come down to enforcement, right? It's are we going to enforce the law? And maybe one final thing, we'll leave it at this. We talk about the people that aren't caught up in the licensing, right? Well, if they're not licensed, then that's where enforcement comes in, right? That's where ABC will have to find out who they are, and if they don't have a license, go after those people. But when we pass laws and regulations, we do want to give the business community time to become licensed, and so especially if it's a new type of thing. So that's what we're having to deal with right now. But I'm going to leave it right there. Thank you for your presentation. I really appreciate it. This is not the end of this topic, that's for sure. We appreciate it. Up next, we're going to start at the beginning now. And just as an announcement, there is a method to our madness here. The reason we don't start at the beginning and we go into some more controversial type regulations is we lose members to other committees. And so we've already lost a couple that have to be in other committees. One was a chair of another committee. So that's why we required you guys to sit through all that. And but we don't do that intentionally. So up first, we have the Education and Labor Cabinet.
Education and Labor Cabinet, Education Professional Standards Board, 16 KAR 4090.
16 KAR 4090 amends to remove language for candidates who have not received rank 2 and allow a district to recommend a candidate for a one-time exception to the 6 graduate hours requirement.
Please state your name for the record.
Cassie Trueblood, Counsel for the Education Professional Standards Board. Always glad to be considered not controversial.
And there have been times, right? Any members have any questions for Mrs. Trueblood? Seeing none, please call the next regulation.
Office of the Attorney General, Office of Regulatory Relief, 40 KAR 12440 and 12520. 40 KAR 12440 has staff suggested amendments.
40-12440 establishes registration, renewal, and surety bond requirements for health spas. The staff suggested amendment amends various sections to comply with KRS Chapter 13A. 40-12520 establishes the application form for transient merchants to file a surety bond if the aggregate market value of goods is $1,500 or more.
Would you please state your name for the record?
Steve Humphers, Executive Director, Kentucky Office of Regulatory Relief.
Thank you so much. What we're doing up here now is we're trying to get one of our members back so we can take care of all the staff amendments. So the committee will stand at ease for a moment. Okay, what we're going to do so we can keep moving is we're going to approve all the staff amendments at one time. And so from this point on, after we consider your regs, please do not leave. Please stay right here. Do we have any questions from members for the Department of Law on these regulations? Seeing none, stay right here. Don't leave yet.
Yes, sir.
Up next is the Kentucky Public Pensions Authority.
Kentucky Public Pensions Authority, 105 KAR 1020, 150, 300, 340, 350, and 445. 105 KAR 1020, 150, 350, and 445 have staff suggested amendments.
This package amends administrative regulations to establish definitions, add benefit calculations for Tier 2 employees, allow installment payments for service credit in specific circumstances, make clarifications related to the determination of service credit for actual and contract days worked by local school board classified employees for school years beginning July 1st, 2000 and after, establish a date by which eligible participants shall provide a petition to the agency to be included on a trustee election ballot, establish requirements for filling trustee vacancies before the expiration of a term, make clarifications and technical updates throughout the administrative regulations, include links to access incorporated material, and update material incorporated by reference. The staff suggested amendments update the title of incorporated material and amend various sections to comply with the drafting and formatting requirements of KRS Chapter 13A.
If you would, please state your name for the record.
I'm Carol Catalfo. I'm the policy specialist for KPPA.
I'm Nathan Goodrich. I'm the staff attorney supervisor for KPPA.
Thank you so much. We really appreciate it. Unfortunately, you do have a staff amendment as well. Representative Bridges is on his way back down, so we're getting him fairly quickly. Any questions from members? Seeing none, you're free for just a minute, but stay around. Just a quick comment. This is beyond our record meeting. Our shortest meeting was 19 minutes, so this has gone a little bit longer. But I do want to remind everyone that this is not the longest meeting in our history. It went from 10 a.m. to 4 p.m. and they had stopped for lunch. So don't complain too much. Up next, we have the
Board of Nursing.
Okay, let's jump ahead to the Board of Nursing.
All right. Board of Nursing, 201 KAR 2476 and 2490.
201 KR 2476 amends to remove the paper application option for submissions of renewal applications in favor of an electronic process and update material incorporated by reference. 201 KAR 2490 amends to require for training requirements in-person and direct supervision by a registered nurse, APRN, physician assistant, licensed physician, or dentist over the licensed practical nurse when completing a competency validation for infusion therapy procedures and update material incorporated by reference.
If you would please state your name for the record.
Kelly Jenkins, Executive Director, Kentucky Board of Nursing.
Good afternoon, Jeff Prather, General Counsel, Board of Nursing.
Thank you so much. Any questions for this group? They have no amendments, so you get out of jail free card.
Thank you.
Thank you so much.
Thank you.
Representative Bridges, welcome back. Appreciate it. We're going to go back. We're going to go back to the Department of Law regulation. There is a staff amendment on the two regulations brought by the Department of Law. Is there a motion? We have a motion from Representative Frazier Gordon with second Co-Chair Lewis. Without objection is so ordered. Department of Law is taken care of. Up next, we have Public Pension Authority. There are staff amendments. Is there a motion for approval of staff amendments? Second. We have a motion and a second. Without objection is so ordered. Public Pension Authority, you're good to go. So committee will stand at ease just a second. I'm going to get reorganized, and let's bring up the Board of Licensure for Occupational Therapy.
201 KAR 28240 emergency.
201 KR 28240 emergency Amends the Occupational Therapy Licensure Compact to update rules on data system reporting and implementation of FBI criminal background check requirements.
Would you please identify yourself for the record? Make sure your microphone's on there.
Lily Coiner, Counsel for the Board of Licensure for Occupational Therapy.
Jill Phelps, Chair of the Board of Licensure for Occupational Therapy.
Thank you so much. Do we have any questions for this group? They have no amendments. Please call the next regulation. Thank you.
Thank you.
Board of Medical Imaging and Radiation Therapy, 201 KAR 46020, 030, and 045. 201 KAR 46045 has staff suggested amendments.
201 KR 46020 amends to establish a $50 fee for the temporary student radiography application and license. 201 KR 46030 amends to update student employment outside the academic clinical setting to authorize employment of those who hold an active temporary student radiography license. 201 KR 4645 amends to update the temporary license to include qualified radiography students that seek employment outside the academic clinical setting and clarify parameters and limitations and incorporate material by reference. The staff amendment amends various sections to comply with KRS Chapter 13A.
Please state your name for the record.
Good afternoon. Elizabeth Morgan, Executive Director for the Board.
Thank you so much. There's a staff amendment. Is there a motion for approval of the staff amendment? Second. We have a motion and a second. Without objection is so ordered. Any questions for the Board of Medical Imaging and Radiation Therapy? Seeing none, please call the next regulation. Thank you.
Tourism, Arts, and Heritage Cabinet, Department of Fish and Wildlife Resources, 301 KAR 6001, 015, and 020. 301 KAR 6001 and 015 have staff suggested amendments.
301 KR 6001 updates definitions. 301 KR 6015 amends to establish restrictions for electric outboard motors. 301 KR 6020 amends to establish requirements for use and maintenance of the manufacturer-installed engine cutoff switch. The staff amendments for 301 KR 6001 and 015 make changes to comply with KRS Chapter 13A.
Please state your name for the record.
Jenny Gilbert, Legislative Liaison.
Stephen Field, Staff Attorney.
Thank you. There are staff amendments. Is there a motion for approval of the staff amendments? Second. We have a motion and a second. Without objection, so ordered. Any questions for Fish and Wildlife? Please call the next regulation. Thank you.
Economic Development Finance Authority, 307 KAR 1006. This regulation has staff suggested amendments.
307 KR 1006 establishes application criteria and fee structure to receive and evaluate applications for the Cabinet's economic incentive programs. The staff amendment amends various sections to comply with KRS Chapter 13A.
If you would, please state your name for the record.
I'm Matt Wingate, General Counsel.
And Chad Zimlick, I'm Deputy General Counsel for the Cabinet.
Thank you so much. There is a staff amendment. Is there a motion for approval of staff amendment? Hold on just a second. We keep losing quorum. And
well,
like when we said herding cats earlier, that's what we're talking about.
We're one of the problem children with the staff amendment. So
Committee will stand at ease.
It's our fault.
There is a staff amendment. Is there a motion for approval of the staff amendment? We have a motion. We have a second. Without objection, so ordered. Any questions for the Cabinet? Seeing none, please call the next regulation. Thank you.
Justice and Public Safety Cabinet, Department of Corrections, 501 KAR 6420 emergency, 460 emergency, 470 emergency, 510 emergency, and 530 emergency.
This package of emergency regulations updates material incorporated by reference and provisions relating to statutory and meritorious good time credits, work time credits, enrollment in an education program, administrative release, and program enrollment.
you would state your name for the record.
Ann Blaylock, General Counsel for the Justice and Public Safety Cabinet.
Good afternoon, Nathan Goins, Assistant General Counsel at the Justice and Public Safety Cabinet.
And I apologize, you have no amendments, so we could have flipped to you sooner. Any questions for the department? Seeing none, please call the next regulation. Thank you.
Department of Juvenile Justice, 505 KAR 1140 Emergency and Ordinary, and 1410 Emergency and Ordinary. Both 505 KAR 1140 and 410 Ordinaries have staff suggested amendments.
505 KR 1140E and O, amend to remove outdated procedures for isolation and protective custody in juvenile detention and youth development centers, and ensure safeguards to protect juveniles placed in isolation. 505 KR 1410E and O, amend to establish safeguards to protect juveniles placed in restrictive housing and protective custody. The amended after comments version for the E, amend section 1 to define restrictive housing, add when it may be used and when visual assessments shall be completed, and remove references to isolation. Amend section 2 to add a provision for modifying a treatment plan and how assessments shall be conducted, and amend section 6 to add provisions for multidisciplinary teams. The staff amendments for 505 KR 1140 and 410 amend various sections to comply with KRS Chapter 13A.
I take my apology back. You were going to have to be here anyway. If you would, please state your name for the record.
Brian Locke, Executive Advisor for the Justice and Public Safety Cabinet.
Thank you. There are staff amendments. Is there a motion for approval of staff amendments? We have a motion. We have a second without objections, so ordered. Any questions from members for the Department of Juvenile Justice? Seeing none, please call the next regulation. Thank you.
Thank you.
Education and Labor Cabinet, Department for Employment Services, Office of Unemployment Insurance, 787 KAR 1370 Emergency.
787 KAR 1370E amends to clarify that benefit experience history shall transfer when a PEO elects client-level reporting, add definitions and instructions necessary for accurate rate assignment.
Would you please identify yourself for the record?
Bernadette Leverage, Staff Attorney for the Education and Labor Cabinet.
Greg Higgins.
Make sure that green light's on if you don't mind there.
Greg Higgins, Executive Director of the Office of Unemployment Insurance.
Thank you so much. There are no amendments. Any questions from members? Seeing none, please call the next regulation. Thank you.
Cabinet for Health and Family Services, Department for Public Health, 902 KAR 055015.
902-55015 is initially filed as bromazolam to the list of Schedule I controlled substances. The amended after comments version adds 7-OH concentrated at a level above 400 parts per million to the list of Schedule I substances.
Please state your name for the record.
Julie Brooks, Policy Specialist for the Department for Public Health.
Hi, Wesley Duke, General Counsel at the Cabinet for Health and Family Services.
I swear this was not meant to punish you in any way, shape, or form. There are no amendments to this regulation. Any questions from members to the Cabinet for Health and Family Services? Seeing none, thank you so much. We appreciate it, and sorry for the delay in being last.
No worries. Thank you all.
Thank you.
That concludes this meeting. Do we have any dates? Do we know when our next meeting will be? Our next meeting will be March 9th, 1 a.m. PM. Maybe it would have been better if it was 1 a.m. Any other business to come before this committee? Seeing none, this meeting is adjourned.